All right, good morning and welcome everybody to the Never Stop Healing podcast. This is your host of the day, Cade Archibald, and really excited to be here with everybody. We got some really cool stuff we're going to be diving into. Before we do, want to just touch base on our hack last night, or the Health Accelerator challenges. We went through some really cool tools, or a really cool tool. Muscle is age reversal medicine, and really going through some awesome ways that we can improve our muscle, improve our longevity and muscle growth and energy. And yeah, it's really cool tool and conversation. If you're not a part of our hack community, make sure you go to acueastwest.com/hack. Jump in there and get involved. It is some really great stuff. I love that tool that you went over with us last night, Regan. I got mine right here, all dialed in.
Yeah, this one. Oh, were you going to share yours?
No, you that's it right there.
Yeah, for those of you who are watching, this is what we went through last night, and I just kind of talked about, ratios of protein, fats, carbohydrates in my past, and hydration's always been pretty dialed in the last like 10 years. What was I doing in the past? Well, more CrossFit, mountain biking, running. I was about an 8 out of 10 on energy. My present is I've increased my protein pretty dramatically and actually lost a lot of fat and increased muscle. And so I'm about 160 grams of protein, 80 grams of fat, 200 grams of carbs. So I do tend to eat more carbohydrates in the summer because the days are longer. And so you've got more glucose burning and less fat storage. And I just sleep better that way. And then I've been doing the Catalyst, more Pilates, big time mountain biking, running dirt bike, working on grip strength, and then doing my Boundless. Team Boundless is the team I'm on in Ben Greenfield's in the Ladder app. So jump in there with me. And then I'm about 9.5 out of 10. And then the future, this winter, I'll be, I'll shave off some on my protein and then increase my fat and decrease my carbohydrates. I'll stay hydrated, and then I want to start working on more muscle mass, and then I want Cade to get me out on the wake surf. Oh, golf is the other big thing I've been working on present, and I want to do it in the future too. Actually, golf this morning, just hit a few balls, and then energy goals it will be 10 out of 10. So we talked about some of the things, the treatments you can do, the testing, some of the peptides like tesamorelin, ipamorelin, and then the fact that you've got to detox if you want to build muscle. And then talked about some foods, get your cell core foundational steps, fermented foods, beets, collagen, colostrum, all those things are great. So yeah, if you missed it last night, we did record it, so jump on there. Andie, we got Andie. Hey, Andie.
Hey, how's it going?
It's going great. How you doing?
Fabulously well, thank you. Got up and did my morning kind of yoga Pilates routine and my belly breathing, and the big fan of the body brushing, as you know. So
yeah.
I love my morning routine. So yeah, I feel awesome. Thank you.
Oh, that's great. Awesome. So we were just covering the Health Accelerator, the hack last night. The big challenge for everybody, it's a tough one because one of the challenges we gave you was to just start tracking more of your ratios, those proteins, fats, carbohydrates. And even if you have to get as nuanced as weighing them, it's easier than it sounds. But you'll be shocked. Most people are just stunned at the fact that they're getting like 50 grams of protein when they're like, oh, I've been getting like 120 grams. What do you mean? So tracking it was the challenge last night. Cade, anything else you got out of last night?
Yeah, the KPV and the KPV spray. I'm pretty excited about that. Gotta get that rolling. So I'm excited to start on the KPV spray when I'm up there.
Have you tried that one, Andie? The new KPV?
No. Can you give me a brief snapshot on it? Because as you know, even though I was in the Park City practice, I'm somewhat new to understanding the depth of the peptides.
Yeah, so KPV is a tripeptide. So it's actually, it works on the melanocorticoid system. So that's one of the pathways that the immune system utilizes, and it becomes very hyperactive if you've had exposure to mold. And so I was telling the group that I was in a hotel in Dallas over the weekend. I was able to teach a longevity event there. And the hotel was pretty old and kind of moldy, but I slept like a baby. I didn't have the typical, I wasn't crying at the front desk, sobbing. Cade's seen me throw a fit in hotels.
He wasn't the sleep diva that he typically is.
But I use KPV, and so KPV can help with mold toxicity. It helps heal leaky gut. They've done interesting studies, Andy, where they'll induce colitis in mice. And then one group of mice will only receive water, and the other group of mice gets KPV and water. And it actually, the mice that got the KPV had a complete remission of the colitis.
Wow.
And then we've seen it in, just clinical applications with colitis. So I know a lot of us don't have pet mice that we want to be giving KPV to, but it does work in humans as well.
No one wants pet mice.
No, but if you do have one and it's got colitis, we've got the treatment.
We
My
have the
eldest
cure.
My oldest had mice as about, I don't know, an 8-year-old, and they had to be kept in the laundry. She brought them into the house, and I thought I had 2 females. I didn't. They escaped. We had these little ginger and white and black tricolored mice in the house for weeks before we managed to catch them all. It was horrifying. No one wants mice.
No one wants mice. No, and they multiply pretty darn fast. So yeah, keeping those
Let
out.
me tell you, they do.
they don't slow down, not at all, those little rodents. Well, yeah, so yesterday, think of muscle as your age reversal medicine, and that was kind of the mindset tool that we shared. And it's a really important tool. So for those of you who, we emailed it to some of you. For those of you who are in our community didn't get that, we'll make sure that all of you get that. And that will be really helpful. And what I'm going to encourage you to do is fill that out. Next time you meet with Andie, she can go through that with you and help kind of give you some coaching and guidance. But it's really designed to get you thinking about your health. Instead of us telling you what to do, it's like, where do you want your future to go? And that's so much more powerful when you create it yourself versus us saying, well, maybe you'd want to, think about when you're 100. What do you need to do to stay super fit at 100? Well, I can tell you, you need to start today, and you need to get new habits in place, because you can't wait until you're 95 to be super fit at 100. It just, it's not going to happen. It's got to be, it needs to start like right now. So
Yeah, the earlier the better.
Earlier the better. Yes.
But it's never too late.
Never too late.
True.
Yeah. Yeah, that's why, this is Never Stop Healing podcast. Is it's like, hey, no matter what age you are, no matter what diagnosis you've been given, no matter how frustrated you might be with your, lack of progress, no matter what you've tried, like it's never too late. And so, we're here to hopefully put the right combinations in place for you when it comes from lifestyle, when it comes to innovative medicine, when it comes to, traditional medicine. All these things are talked about on this show. So, and today we're going to talk about something really powerful. What are we going to cover today, Cade? I'll put it, you asked me, so I'm gonna put it on you. What do you want me to talk about? What do you want Andie and I to discuss, and the three of us?
Yeah, I'm excited to dive into some good, some effective options for neuropathy treatments. I think that sounds really, really intriguing.
And so that is, we can do that. Wish granted. And did you know what neuropathy is?
Well, I know, and I personally have a couple of friends that have gone through chemotherapy that have been left with neuropathy. And I know one of our components is acute, which is really effective. So it's residual nerve pain and issues that result in, just really uncomfortable, painful symptoms. Yeah.
Right. Yeah, and so and chemotherapy is one of the causes. Diabetes is another
Yeah.
one. I had a patient who it was devastating. He was the coolest human being, but he was painting a sealant on concrete, and he painted himself into a corner, and then he had to walk on his socks across the wet floor as he's painting it. He didn't think anything of it. This was in the 90s, and the chemicals from that concrete sealant, they soaked into his nerves, and he started noticing numbness, tingling. He started getting burning sensations. He felt like his socks were bunched up, and he got to the point where that neuropathy spread all the way up his legs after about 20 years. And then he got central neuropathy, and we were treating him with acupuncture. We were doing some regenerative medicine, PRP, and he was improving to the point where he could sense hot and cold, because that's another sign of neuropathy, is when you put your feet in hot water and you don't know it's hot and you burn your feet, or you put it in cold water and you don't feel the cold. Those are some of the symptoms. And he was doing great. And the unfortunate part is, with central neuropathy, you stop breathing when you sleep. So you have to wear a CPAP, otherwise it's game over. And he fell asleep without a CPAP on and passed away the night after I saw him. Devastating. So tell your friends, make sure you do not take this condition lightly, because it's a degenerative condition that tends to accelerate over time. With chemotherapy, there's that's a pretty good chance that there's still some reversal capabilities available. So we'll jump into all the nuances on neuropathy. So
yeah, let's dive in. It's something we're seeing more and more of. I think it's a condition that's just accelerating with more diabetes. It's more prevalent. It can be caused by my back issues, spinal problems, and then just kind of different damage to the peripheral extremities. Can start that process. So it's I think we're seeing more and more patients come in with those problems, and what's exciting is there's more and more innovations that are available that we found that are just doing some amazing things for it.
And so debilitating. You don't have to put up with that. And from what I'm learning right now, Regan, the earlier the people come in and treat that, with talking about the condition accelerating, the earlier, absolutely the better.
Yeah, that's it. And so neuropathy is kind of interesting because, and you're right, Andie, any degenerative condition that affects the nerves, time is of the essence. And so right now, about 8% of the US population suffers from neuropathy, from specifically peripheral neuropathy. And it's becoming more and more common in the United States. So 8%, that puts us at about 25 to 30 million people suffer from this, but it can occur at any age. And if you think about what neuropathy means, it means damage to or disease in the affecting nerves. And so peripheral means away from the center. So it's that's usually like hands and legs central. The patient I shared his, the unfortunate thing is when it becomes when it impacts the central nervous system, it's deadly. So most people don't ever get central. That's like less than 1%. But neuropathy can affect the feet most commonly, the hands, the legs, and even up into the arms. And so your friends who have had chemotherapy, what are they experiencing, Andie?
It's in the feet.
It's in the feet primarily.
Yeah.
Okay.
Yeah.
And are they noticing like, kind of pins and needles when they walk, or is it other symptoms?
Yeah, the pins and needles, but also just that constant ongoing discomfort.
Yeah,
it's just like constantly aware of it. There doesn't seem to be any respite.
Yeah. Okay. And that's the crazy thing about it. So one of our doctors, you remember Dr. Marchionda, and I'm only sharing this because she's spoken openly about her chemotherapy-induced neuropathy in the past. But Dr. Marchionda, she's our Go Wellness medical director. She's she's been our medical director over our clinics in the past as well. But her chemotherapy, she actually had breast cancer in medical school and then underwent chemotherapy. I think it was about a year of treatments while she's in medical school, and she's brilliant. She's amazing. But the one thing that happened is it really impacted her hair. And then her neuropathy is still not completely resolved, but she's done a lot. She's improved it by about 80% with some of the therapies we'll talk about today. But neuropathy is one of those conditions that, if you look at the causative factors, some of neuropathy is what's called idiopathic, and that just means we don't know. And that relates to about 50% of neuropathy. It shows up in patients, and we look at an X-ray on their spine. So every neuropathy patient that we see, we'll do an image on the spine, and we'll see, okay, is there any compression, or is there stenosis where there's a narrowing in the spinal canal? Is there facet joint narrowing, or those are the joints off to the side where the major nerves run through? Is there an issue with spondylolisthesis? That's where you have a shelving in your spine. All these things can relate to it. The other, issue with diabetes is about 30 to 35% of neuropathic pain comes from diabetes. And if you think about what diabetes is, diabetes or insulin resistance, it creates an environment where there's just massive spikes of inflammation. And Cade or Andie, have you guys ever been in an anatomy class and worked with cadavers?
No, I haven't.
It's been a really long time.
The cadavers are kind of fascinating. I mean, I really enjoyed anatomy, and I had an amazing teacher, Dr. Nelson. He's actually renowned anatomy instructor, and I didn't realize it until I got to my Chinese medical school in Hawaii, and my anatomy skills was like 10 times better. Even we had a couple MDs in our class, and it was because of the teacher that I had. But if you look at the nerves, right next to every nerve, there's an artery and a vein. And so your nerves are totally connected to your blood vessels, and we forget that sometimes. But with diabetes, your body's having this constant damage. Every time your blood sugar goes up, you damage your arterial lining, and then every time it drops, there's another spike of inflammation that damages the arterial lining. And one of the reasons why we have cholesterol is because cholesterol repairs that damage. It's kind of like sending in the mason to go fix the brick, and he puts the new mortar in there as the brick kind of separates and comes back down. So with diabetes, one of the things that happens is you just get this chronic degradation in the blood vessels, which impacts the nerves that are circulating right next to it. And so it's something that a lot of people, they just forget that, man. Overeating, for example, or when I love to eat that sugar, if I give myself a window where I can eat some dessert, I make sure that I go out and do some exercise, go on a walk, do something so that blood sugar is actually getting utilized. The last thing you want to do is eat a big meal, or, eat some sweets and then go sit and watch a movie. Because what's the sugar going to do? Well, it's going to circulate in your body, and your muscles don't need it. And so then it either gets stored as fat, but in the meantime, it's damaging your arterial wall. So that's a major cause of neuropathy there. Poor circulation. It's called peripheral arterial disease, and that's a big reason. We talked about toxins, but we've also seen neuropathy. We've got a patient right now who had a massive viral infection, and we think it's from rickettsia. So it's from it's a deer tick, and so the Rocky Mountain fever. You guys have heard of Rocky Mountain fever from tick bites. His came after that, and so we're actually treating him for an infection with his neuropathy. He had no neuropathy before that. He was golfing. He actually used to hike Timp every year. This is a man in his 70s, his late 70s. And he's like, I can't even hike Timp with my grandkids. They think I'm weak. And he's, because this infection really damaged his nerves. Stroke, you'll see, strokes can sometimes cause symptoms of it. Liver disease, kidney disease, even the thyroid can cause issues. So those are some of the causes. So if we look at neuropathy, and Andie, what would you say would be the biggest risk if someone started losing balance later in life? What do you see in people who lose their balance actually when it comes to?
Well, they're a fall risk.
Yeah.
Yeah. Yeah.
And I don't know what the exact studies are, and you may, but I think after 65, I know falls are the leading injury-related death after 65. The one injury that's going to get us the most is if we fall, and that's what it can cause death. But I've also seen studies on mortality, and I wish I could quote this better, but I don't know, Cade or Andie, if you guys look it up in the background, but if you say, mortality rates in people who fall and break a hip, it basically shaves off 10 years of your overall lifespan if you fall and break a hip. So this is where balance is really critical. And then we're sending all of our patients to get the DEXA scan. And the DEXA scan is pretty awesome because we can see your bone density. So you can actually see how healthy your bones may or may not be. You can see spots where you may have some osteopenia or osteoporosis building up. But this is really critical. And then you can see your muscle mass to adipose ratio. So Andie, have you gotten yours yet? Gone into the DEXA scan place?
No, I haven't. Look, I'm really looking forward to doing it. And I have been so focused on my wellness journey previously in pockets, but when I was looking after the Park City Clinic for you, that certainly boosted me back into it. So I need to have that baseline, which is so valuable because you really get that snapshot. But yeah, I haven't made it happen yet.
Okay. And I've got to get mine done again. It's been about 6 months. So I want to see where I'm at now. So we need to just set up a little time and when we're in the office and just sneak over there and get it done. Cause it literally takes like 10 minutes. It's fast.
Right. And I mean, I'm happy to share it on here and let people see my results and see what I need to focus on. I can be your poster child potentially.
There we go. Yeah. Well, you've already made some massive progress too. And I'm excited. We looked at, I did 2 of the images yesterday with patients. I did their reviews on it. And it's really exciting to see just, because the lean muscle mass was actually really powerful in the 2 patients I saw.
So this was their baseline?
This was their baseline, yes. But one of them had actually done it a year prior to working with us, and her markers were down by about 20%. Overall adipose tissue. So that was actually really cool to see. Yeah. So one thing you can do, because if you have neuropathy, the falls are a big thing, and breaking a hip is a big thing. But one thing that can also show up is slow healing wounds. And one of the very biggest things that we treat in Hawaii is I did my internship at the Northern Hawaii Community College, or not community college, Northern Hawaii Hospital. And so we would go across the street, and it was like a half mile from my school. And every patient who came into that hospital received some type of holistic care. And so we would do a variety of therapies on it. But in Hawaii, diabetes is really big. And so neuropathy was prevalent as well. And one of our patients, had stepped on a sliver because, wearing shoes in Hawaii is always optional, and people, just wear slippers. And so we took off his slipper. He's like, "Oh, bro, my foot, it killing me. And it smells like death." And we took off his shoe, and it was all infected. He had this big ulcer that he couldn't see. It was probably 400 pounds. And so he couldn't look at his foot, and he'd had an ulcer there for about 2 weeks, and it was getting gangrenous, and it smelled literally like rotting flesh. And it wasn't until he smelled it that he actually took the initiative to get some medical help. And so this is it's a big deal, you know, when you start losing sensation in your feet. And then the other thing that we see is what's called restless leg syndrome. And that's where at night you're trying to sleep and your legs are moving all over, and there's just like, you just don't feel comfortable. And I think that's probably kind of what you were alluding to with your friends, Andie, with the chemotherapy.
Yeah.
Yeah, just like it's always like there's kind of this tingling, this numbness. You just don't feel completely settled.
It's like an inability to totally relax.
Yeah.
Physically. Yeah.
Yeah, and that's a big thing, and unfortunately the treatments, you know, I worked with Dr. Pam Vincent when I got out of school. I originally wanted to go into more Western medicine and learn conventional medicine, but I was misdiagnosed by 5 MDs, and I thought it was a naturopathic doctor and who was also an acupuncturist who basically said, "Hey, you've got Hashimoto's, Regan." So I took a different course in my training, more of an integrated medical school, but I wanted to work with conventional doctors. So when I got out of school, I actually worked with a neurologist for the first 7 years, Pam Vincent. Cade, you never met Pam, did you?
No, I remember that office.
Yeah. Did you meet
Never
Nikki? Do you remember her daughter, Nikki? She was my
Yeah,
first.
we did that relay race with her.
That's right. Yeah. Spencer, her husband, and Nikki. Yeah. So Pam was just a good friend, but she's a neurologist. So that's where you go if you have neuropathies, you go see a specialist. And when I showed up there, she was so frustrated at what she was giving her patients for neuropathy. She said, "It doesn't help. I'm using this off-label medication called gabapentin. And unfortunately, the patients they feel like their brain doesn't work when they're on it. They feel like the more medication they take, the dumber they become." And so she's like, and then the drug rep comes and says, "Give them Lyrica." And, you know, and she said, these things are just masking a symptom. There's a deeper cause there. And so she and I started working with her patients. And one of the interesting things that she was told is that gabapentin is not habit forming. And so, you know, as doctors, they have to trust the drug reps. And this was almost 20 years ago. And she got so frustrated because when we went to take patients, she would start taking patients off the medication as they're going through my treatment protocol. And the patients would start having these massive detox symptoms. And one of the patients, you know, was just horrible. I mean, it was almost to the point of hospitalization. And so she finally made a new policy in her clinic that no more free lunch for anyone, no more drug reps. So we lost free lunch, but she made a good point of saying, "I'm not trusting this anymore." And so it's just a phenomenal doctor, but pretty interesting how that worked out.
Yeah, the pharmaceutical reps are bribing doctors with food and lunch and golf matches, you name it.
There's kickbacks on the back end. Yeah, doctors don't make their salary through the hospital, that's for sure.
Yeah. There's actually legislation came in Australia when I was surgical medical repping many years ago, and you couldn't spend over $50, and this was in the pharmaceutical industry also, without, you know, it was all recorded in the company, and you could be audited on what you had been spending on clients.
Wow.
It was 50 per person, or?
I don't remember. It's many years ago. How old is Jackson now? Jackson is turning 20, and he was about 7 when I left that role. So I don't remember the details, but I remember it being $50, and you could be audited, you know, like you had to show what you had been spending on clients, that you weren't bribing them, basically.
Yeah.
But that was surgical medical supplies, and it was also the same in the pharmaceutical industry to stop that very thing.
Man, well, it's interesting because there's only 2 countries that allow advertising for pharmaceutical drugs. And one of those is obviously the United States. If you've ever watched TV, it's like every 3rd commercial, and then New Zealand. So
Yeah, I haven't lived in New Zealand for so long. I moved to Australia in 95.
Yeah.
Mind you, I was there in 2020 when my granddaughters were born, and I don't remember seeing a lot of pharmaceutical advertisements. I don't remember seeing any, but certainly it was the big thing culturally for me moving here. I was like, oh, there's a solution to everything in a pill if you go to your doctor.
Yes.
Did you not know that, Andie?
We have the answers.
Yeah, where was that information? But the funny thing is that I really noticed is half of the advertisement is the side effects.
Oh yeah. The last they try to crunch it down, but usually it lasts like half the commercial is the list of potential side effects and harm
and also
or death.
the one, or don't take it if you're allergic to this. How do you know if you're allergic? You know, like, what's going on, people?
Here's a new medication. If you're allergic to it, don't take it.
Yeah, but look, I'm not saying, sometimes, pharmaceutical medications do have their place, but I just felt I moved to a country where, and, of course we knew about this, and when I was living in Australia and New Zealand, we see the US as, medications being very available, easily dispensed. And, moving here and getting to know people and, realizing how many people are on medications, I actually was, have you got a short story?
Yeah.
When I moved here, because I was too old to have any of my childhood vaccines, I couldn't produce any proof. I was 53 when I moved here. So I had to revaccinate for some childhood illnesses.
Oh, wow.
Yeah. For immigration, I had to show I'd had these done. And I ended up having the flu shot on the same day. I said, but I've never had the flu. I've got a great immune system. I'm really healthy. And I kind of felt like I was pressured into it, which me, and that's a rare thing. I just say flat out, I'm black and white. No, you're not doing that to me. So I had it. I ended up in the ER with serum sickness. I was really sick within 5 hours. I was really sick from it. And this doesn't happen to everyone. This is my experience. And the doctor that was admitting me said, what medications are you on? I said, I'm not on any medications. And she said, you're 53. What medications are you on? I mean, what tablets do you take every day? I said, I know what you mean. I said, we're designed to be healthy. I'm not on any. And she couldn't believe it. She was like, wow. And I was like, am I really the exception?
Yes.
It was interesting.
Isn't that crazy?
Yeah.
Man, so have you recovered from the serum sickness?
Yes, it was very short-lived. And I was told, it's also available in a nasal spray version. But they said, don't take that, you'll react to that. And I said, oh, I will never be having this again.
Good for you. Well, and I think this is the crazy thing is if you look at the United States, we make up about 5% of the world's population, 340 million, somewhere give or take. And we consume 75% of the medications. So it is absolutely insane. And so with neuropathy, Dr. Vincent and I, what we saw is like, there's actually solutions for it. And some of these solutions are just life-changing for patients. When I started to see patients regain their balance, there was a direct correlation to their confidence levels increasing. And so they started looking younger. And, when you see someone kind of hobbling in and worried, I'm telling them there's a rug right there, watch and holding them. And then they come in, 2 months later and they're stepping in and they can, navigate, they can get on the table themselves. Like it was really fun to see. And now we're just saying that there's incredible options, but there's kind of 3 steps that need to happen is what we've found with neuropathy. Number one is, remove the inflammation. That's number one. What is the interference that's getting in the way that's causing the inflammation and keeping those nerves and your brain from communicating? And so there's different ways we can remove inflammation. One of those kind of novel ways that we've done that is with the use of acupuncture, and Andie mentioned this earlier. And one of our good friends, Dr. Gene Healy, Cade knows Gene very well down in Florida. Andie, you probably would know Gene if you saw him. He's at all the Go Wellness events, but
Oh, okay.
he did an entire clinical study on peripheral neuropathy with acupuncture. And, he had the whole placebo where he's doing sham acupuncture versus real. And then he used herbs and supplements to promote nitric oxide. And so nitric oxide is the #1 neuro chemical that we need to promote better vascular dilation. And so Gene was very successful. His clinical trials proved to be phenomenal. So that's one of the ways we remove inflammation. The other way is through the use of PRP and perinatal allografts. And there's actually some interesting studies on PRP for neuropathy. And by the way, PRP, maybe Cade, you could explain what PRP is, because I doubt everyone knows what PRP is.
Yeah, that's probably a good thing to explain. So PRP is it stands for platelet-rich plasma. So this is where we will draw someone's blood, spin it in a centrifuge, and then we take there's like this golden kind of creamy top that's all your rich, nutrient-rich plasma. So there's some really good growth factors, cytokines, and just some really good, powerful healing properties in that portion of the blood. And so we'll inject that into specific nerve routes in the areas.
Yeah, PRP is amazing. One of the studies that was published March or April of 2020, just a couple of years ago, what they did is they wondered, could PRP make any difference for diabetic neuropathic pain? Because this is a big thing. And so they took 60 patients, all who were clinically diagnosed. One group of patients got conventional treatment. So they got the drugs, Andie, that were in the United States. So we're like, let's give them conventional treatments. They were probably over 53 and they need to be on at least 5 medications. So every decade of life, we had five medications starting in your 40s. So,
Great. Things to look forward to.
So we really need to talk about this. But what they found is that the group that did PRP had actually, they had a result. The group that did the gabapentin didn't really have much of an improvement. And actually 92% of them got off of the gabapentin before the year-long trial was up. They just didn't like it. They didn't like the way they felt. They didn't feel like the results was significant enough to stay on it. But the group that got the PRP injection, they found that was a much more effective alleviation of their neuropathic pain and numbness and tingling over anything else that they'd done. And so this procedure was done under ultrasound. It was done in specific nerve pathways like Cade mentioned. And so this is something that we're doing in the clinic as well. And it's been very exciting. And then probably the biggest breakthrough that we've seen is called neuromodulation. So that's a kind of a fancy word. When I say neuromodulation, does that make any sense to you, Andie, or does that just sound like Regan's trying to be smart?
Well, you're talking about the nerves changing potentially. Is that what that means?
That's it. Yeah,
okay.
That's it. Just like, changing the nerve pattern and reprogramming the nerves is essentially what it is. So there's a cool device that we've got. Our new pain interventional doctor, Dr. Reed, is actually has enormous experience. I don't know how many of these devices she's done. Cade, you might know. I've heard like 2,500, but I don't know exactly. Do you know the exact number that Dr. Reed's done on these the neuromodulation, the Nevro or the spinal cord stimulator?
No, I'm not certain how many. I know it, with the group that we work with, they're doing anywhere from they're a few thousand. And I think this is where we have a lot of potential there.
Yeah, so Dr. Reed is, you guys will meet her, you'll see her at the clinics. She's moving from Minnesota. But one of the things that the research shows in using neuromodulation is for those of you who have like that just unrelenting neuropathic pain, there's a nice device that you can actually utilize that sends a current up the spine to calm the nerves and create better communication from your brain to the peripheral nerves. And it's a little battery pack that runs a little electrical pulse. It sits on the lower part of the back, and it's a 7-day trial. And what the research shows that anywhere from 76 to 85% of patients who utilized it had at least a 50% reduction in their pain. And I'll share a slide with you so you can see kind of the overall results of this at 6 months. But it's pretty phenomenal when you look at, bringing in some new things. But this is where you can see the numbness. So for those of you who are listening, I'll try to explain it as well as possible. But for patients who have the neuropathic pain, the ones who received the spinal cord stimulator or the Nevro, the neuromodulation, you can see there's numbness in their feet, and that's indicative of the red. And then you can see where the red is primarily resolved, and it's primarily yellow. So that means they had about a 50% reduction in numbness. On the tingling in the feet. And the nice thing about this device is you can use it when you drive, you can use it when you sleep, you can use it at any time. And when people first get it implanted, they wake up and they say, wow, I feel amazing.
Yeah,
So sorry, explain that, Regan. It's implanted, so it's a permanent device, or is it a treatment course? What happens? That work?
Yeah, so it's a temporary device at first, and then so that's called a trial. And then after about a week, then we can determine if that device is actually something that the patient wants to get installed permanently. And by permanent, you can still get it removed at any time. But one of the beautiful things about it is it gives us the opportunity to really get some healing. And movement is part of the healing process. And it's really hard to move when your feet are numb, they're tingling, when you have ulcers. So this becomes really powerful. I saw you guys freeze up for a second there as my internet, was it glitching?
Your audio worked great. Your
Okay.
screen kind of froze for a second. So we're good there. No worries.
Okay, great.
I think this is really exciting because I think the fact that it's something that you can literally adjust on your phone. We're seeing, patients can have their pain just significantly diminished or gone with it. And, initially you get a week to try it out too, before it's like, hey, this is going to work. So we try it out, make sure, hey, this is the best option for us. And I just think it's an awesome treatment option for people with neuropathy that haven't had success. It's also really effective with like spinal, just different back issues that have been non-resolved. There's a lot of good things that can help just zap the pain so you can at least get back to functioning.
And just looking at the markers that you're measuring, numbness, tingling, and burning, that's, I can't imagine putting up with that and having that in my life. And,
I just I imagine it's like, when your foot falls asleep, just think about having that kind of pain like all the time. Oh, it's just
horrible.
It's
but living with chronic pain too, it's something. I might have a bout of something where, I've hurt myself and I've got pain for a short term. And I'm always saying, I don't know how people live with chronic pain because it's so debilitating. So to have new solutions like this is something that is so significant for people. And also, dovetailed into touching on that, the pharmaceutical solution option.
the drug solution.
I don't quite know how to verbalize that, and but dovetailing it into those issues and being able to help someone significantly in a drug-free way is so significant.
Yeah, massive. So yeah, here's the burning, and you can see, like, the burning, it's about 80%. And this is through thermal imaging. And then you can see after the device is implanted, like that goes down. The burning was almost completely resolved. So if you have any burning, it's amazing. And especially what Cade said is, this is FDA approved. It passed the phase 3 clinical trials a couple of years ago, but it's one of the most sophisticated devices. There's been others over the last 60 years, but they're kind of clunky, didn't always work. This one seems to be very helpful, but one of the major indications is, failed back pain that has failed conventional therapies or alternative therapies. This can give you a nice reprieve and get your body moving again, and then get the regeneration going. And it's pretty amazing. So here's the cold. So, you can see there's 80% or more where there's no cold sensations. And then you can see after the device, once they turn the device on, that number was decreased, almost 60%. So pretty exciting when you look at the capabilities when it comes to neuropathy.
We had a question come in from Allie. So once someone's been diagnosed with neuropathy, and if they haven't been eating a good diet, can drastically changing their nutritional intake help to reverse neuropathy pain?
Man, and that's the final thing. And I love that, because that question came at the perfect time, because herein lies the rub, is having a device, having neuromodulation done is, once again, it's a band-aid because things aren't fixed, but actually it's been shown to retrain your brain on how to communicate with the peripheral nerves. But if you don't have an anti-inflammatory diet, if you're still eating sugar, if your blood sugar is not regulated, for example, you have toxic chemicals you're putting into your body, your liver is backed up, you're not going to get the long-term results. Because remember, neuropathy, hopefully from our conversation today, you realize, remember, the blood vessels run right next to the nerves, and those nerves need nutrients. And so getting your diet on point is so critical. Lots of good vegetables, great protein, lots of exercise, healthy fats. That makes for a much better overall result in any condition, and especially neuropathy. Beautiful. Well, what else do we got today before we finish up? Any takeaways from today's conversation, Andie or Cade?
Oh, seeing those results, those images, blows me away, of the results at 6 months, from baseline to 6 months. That's phenomenal.
Yeah, really amazing. How about you, Cade?
Yeah, I think it's just exciting to see that there is there's effective options for neuropathy, some really good treatment options out there. It's one of those conditions that most patients are told there's no cure, and there's no way to really combat it other than you can take some gabapentin or some Lyrica, and it helps a little. But then we talked about the side effects. So I just think it's really exciting to see, hey, there's some really cool, effective treatment options out there. And I think the way that we bundle it together, where we have the Nevro device where we're doing the neuromodulation, so those you reduce or just eliminate that pain, and then we're regenerating those at the same time with some of our other treatments like PRP, some tissue allografts, some acupuncture, even nutrition. Ali asked about that. Like, those are all things that can help build that blood flow and circulation, so those nerves can potentially repair. But at the same time, you're feeling right. You can function, you can walk, you can move. Just so exciting to see that we have some really good options for those patients.
Yeah, it's the potential to give someone their life back. Like functioning how you used to, and participating in ways you want to enjoy and that you're passionate about.
Man,
Totally.
Yeah, and I think we'll go back to the beginning. Our mindset tool is muscle is age reversal medicine. And it's really hard to put on muscle when you've got no sensations in your feet. And it's hard to enjoy physical activities. And it's hard to imagine having that fitness 50 at age 100 when you're in pain all the time. So get it taken care of today. Easy to reach out to us. You can reach out to us, go to integratedpainspecialist.com. You can also go to AcuEastWest.com, and we're happy to get you connected. If you happen to know somebody who does have neuropathic pain, back pain, neck pain, give them this podcast, share it with them. It might change their life. I mean, literally, there's so many things that can happen that can be transformative. So share it, give us a review on iTunes. We'd love that. And thanks everyone for being part of our community. Really appreciate you, Cade and Andie, for being on today. That was fun.
Pleasure.
Awesome. Thank you, guys. We'll be back same time, same place next week. Have an amazing one. See you, everybody.
Bye-bye.
See you, team.